You know, one of the things I hope that it is that it's happening within your organization is that you are meeting the NFPA 1582 standard with respect to having an annual firefighter wellness evaluation that's being performed. There should be one that's conducted at the time of hire and then annually thereafter. I know that there's been some municipalities that have been trying to make some adjustments on that and pushing it out to 18 months or to 24 months. And the preference is, of course, is that you're doing them annually. And that is so that we can find many things that may be happening with you, not only physically, but we look at other things as well. And so some of that cancer screening that's being done, which has been a great discussion here tonight, and I appreciate each one of those docs that have taken the time to be here and to make the presentation and to help us all recognize the importance of making certain that we're screening for certain things. But you have to remember too, you have some cardiovascular disease that can also occur. Diabetes can also be something that comes up. And many of the other kinds of conditions that we look at, some of them are actually very treatable when found early, and actually you can change them with nutrition and exercise. And so if you just take a look at that, that becomes quite important for you. And so please make certain that you're having an opportunity to have that annual exam. And if you're working with a fire agency that does not currently do an annual firefighter evaluation, I would encourage that to be done. And if need be, if you struggle with some of that, please get in touch with the City of Mesa, and I'm happy to even sit down with your administration and help them understand the importance of having those annual exams done. Because some of the things are, you begin with some laboratory testing, and we look at a urinalysis, and then we move forward, and it is that you actually come in for the evaluation itself, to have a physical exam. Every woman, female firefighter that comes through our location, we actually offer them a Pap Smear, and not all take us up on it. Some get it done on their own, with their own physician, and that's fine. And we think that it's important that it's being done. We encourage those kinds of things to be done, as well as mammography. Now, just one thing to point out is that there is 3D mammography now that is available, and it's actually doing quite well. The breast just goes onto a plate, and there's a circular piece that comes around the breast, and if those women that are old enough that have had their mammography done, there's no more squashing of the breast like there was once before. It doesn't have to be done that way. So there's newer technology that is available to you. And so please know that, and don't be afraid of it, because it is something that's quite important. A couple things I wanted to just kind of point out outside of just cardiovascular disease, but the other piece is making certain we observe what your pulmonary function is doing. Because if we don't evaluate that, your pulmonary capacity, your ability to breathe or oxygenate, is something quite critical and important. And so we need to make certain that your lungs have a good enough capacity to where it is that you can function so that you can actually perform or do your work. And we can't have you becoming too fatigued when it is that you're fighting fire or doing your job because of the fact that your fitness is not where your fitness needs to be, or that your pulmonary function is not at the capacity where we really need it to be. And so we evaluate those things on an annual basis. There are certain things that it is a firefighter may have at the time of hire which would actually negate their opportunity to serve as a firefighter. Whereas if it is that happened to an incumbent firefighter, so that they're on the job for more than a year and they develop certain conditions, we can then clear them still to continue to work as firefighters. So that's something to become important as well, just to kind of take a look at. So a person that, I'll give you an example, a person that may come to us with a pacemaker and they're coming for their new hire physical, we cannot approve them to be hired as a firefighter. But if you've been a firefighter for more than a year and you end up needing a pacemaker, you can continue on with your job. And we've done some evaluations on things like that. What is the temperature ratings of what a pacemaker can actually undertake, the leads that come off of that pacemaker that actually implant within the myocardium so that you can continue to keep your heart rhythm going at that same time. We've gone and done a lot of evaluation and assessment on that, and so we know what those things look like. And so it's safe for you to have a pacemaker and still continue your service as a firefighter. I wanted to point out, any questions about anything? I don't want to keep you guys here all night, but I wanted to point out just something that's really important that I believe, and that's about the Presumptive Cancer Law that's been passed here in the state of Arizona. It's in many states across the country now. And so just bringing it up and talking about what these cancers have looked like, please know that if you do develop a cancer during your time as a firefighter, it is something that is likely going to be covered, and there are certain benefits that are available to you. And if that happens, we will sit down and talk about that, but just know that you will be helped through the entire process. And so don't feel as though you'll ever be alone. We don't want you to ever feel that way. Please know that your agency will help you, and there are others in the medical community that can continue to help you as well, and we can help provide some guidance and assistance and see to it that not only are you getting appropriate care and treatment, but that we're going to help through that presumptive cancer law to get you the financial benefits that become important for you for the balance of your life. I think that's important to really to know. And the other piece is that President Trump, about a year and 3 months ago, he had signed a law that went into effect. It was the Firefighter Cancer Registry, which is putting the CDC on alert that they must now continue to collect research on cancers that are being found amongst our firefighters. And so that is information that now the CDC is collecting, and it's important for us to see that. It's going to help us not today. It did help us back 5 years ago, and it doesn't help us a lot today, but it's going to help us as we go forward, because we're going to be able to identify much of what is taking place, and we can look at carcinogens and your exposures and start to identify really what some of those causes may have been. And so again, that's something quite important. So I want to switch gears for just 1 second and talk a little bit about Australia. Yes, it is a place of significant skin cancer. I learned that when I was a medical student about, I don't know, it seems like about 30 years ago at this point. And it's quite interesting that what's happening in Australia today. And Australia being in the southern hemisphere, and of course the United States being in the northern hemisphere, influenza is attacking that country just in a horrible way. There have been over 270,000 individuals that have been diagnosed with influenza this year, and up to this date, as of yesterday, there were just over 700 deaths that had occurred because of influenza. Now, that also began about 6 weeks earlier than what their typical influenza season actually is. And we have already identified here in Maricopa County, it's a total of 56 cases of influenza that have happened here. And so we're having an earlier flu season that's starting. And so if you've not received your flu shot, please get it before Halloween, because it takes 2 weeks for that to actually become effective. The strain that's causing problems is H3N2, and that's the one that is actually causing deaths. And so the current flu vaccine will help you against an H3N2. And so please get out there and get that done. All right? Do you have any questions about anything? Otherwise, I think we're going to cut you loose. Is that right, Scott?
Got a couple more things.
Oh, a couple more things from Scott, and he'll keep us here until 9 o'clock. Here we are.